Hi, my name is Dr. Nicole Kunar. I am a family medicine physician working at Beacon Medical Group on Ireland Road. Today I'm going to talk to you guys about cardiovascular events and women's health and how they kind of go together and correspond to each other. It would actually probably surprise you to know that a woman's lifetime risk of having a heart attack is greater than her risk of developing breast cancer. So about 1 in 8 women develop breast cancer in their lifetime. And the risk for having a heart attack or other cardiovascular event is actually even greater than that. Cardiovascular disease is the #1 killer in women. And it's important that we talk about the risk factors and all the ways that we can become proactive in reducing our risk of cardiovascular events. So some of the more common risk factors that people usually know about are the chronic medical conditions that can lead up to cardiovascular disease and heart attacks, things like that. So that would include high blood pressure, high cholesterol, diabetes, obesity. And then we have the more preventable risk factors that include smoking, poor diet, lack of exercise, and alcohol consumption can actually also lead to our increased risk of cardiovascular events. The other most important things to note are family history. So there's family history of cardiovascular events and age. Those are things we obviously can't control, but it's important to know if you do have a strong family history of cardiovascular events, your risk is likely higher. And so to be extra, cautious and aware and proactive in maintaining your lifestyle is going to be really important. So some ways to work on decreasing your risk of cardiovascular events would be to maintain an overall healthy lifestyle. So that would include eating a healthy, well-balanced diet. So the Mediterranean style diet is very well studied and a great diet in reducing your overall cardiovascular events. So that would include eating lots of fresh produce, so fruits, vegetables, healthy fats, so the omega-3s, so a lot of cod, salmon, walnuts, avocados, olive oils instead of the butters, lean protein in there as well. So getting a well-balanced diet that's full of fresh whole foods, less packaged processed foods, all of that is going to be a really important part in reducing our risk of cardiovascular events. And then exercise is the next biggest one. We shoot for 150 minutes of moderate intensity cardiovascular exercise a week. So that would include a brisk walk, 30 minutes, just 5 days a week, or whatever you like to do to get your heart rate up and pumping. It's going to really reduce the risk. Decreasing things that are not good for cardiovascular, including smoking, alcohol, maintaining healthy habits for managing stress is really important. So making sure that we're having good techniques to reduce our stress levels overall is going to be very important. Yeah, so women tend to have slightly more subtle symptoms of a heart attack. They can definitely have the more typical chest pain, pressure, palpitations, shortness of breath, but they can also have more subtle symptoms such as nausea, indigestion, feeling like an acid reflux type picture that's just not going away with things that typically improve their symptoms. Jaw pain, arm pain, things like that can all be symptoms in women in particular that are not as classic as men. That would say, hey, maybe I need to go be evaluated. If it's severe, go straight to the ER. Call 911. If it's more subtle and you're not sure, follow up with your primary care doctor to make sure we're not dealing with something more than just your average acid reflux or other symptoms that may be overlooked. We often take care of everybody else and make sure everyone else's health is in order, and we put our own symptoms on the back burner, even just our own overall health. So exercising is kind of the last thing we think about, but I think it's really important to make sure we're taking care of ourselves so that we can take care of everybody else, and making sure that we are getting ourselves in to see the doctor, doing the things that we need to do to exercise, eat healthy, meal prep, just stay healthy overall is going to be very important. Making sure that we get in to see our primary care doctors regularly to help reduce our risk of overall cardiovascular events is really important. If you do need a primary care doctor, feel free to visit beaconhealthsystem.org, and we're happy to help you.